Some pain science and pain reprocessing therapy avenues will try to tell you that central sensitization is hallucinating pain, and then they'll try to diagnose you with central sensitization based on an inventory of questions like this one. There are major issues with those things. This is from a medical journal article, not a website like the first slide I showed, and it's on central sensitization. And it points out that central sensitization is also commonly seen in individuals with chronic conditions and illnesses where there is clearly ongoing nociceptive input. In other words, not just in your brain, an actual pathophysiology, something wrong in your body, something physiologically happening to your body that is wrong, that is not just coming from misfiring or pain hallucinations. Things like cancer and autoimmune disorders and arthritis and sickle cell disease, congenital things, hypermobility syndromes. The pain science and pain reprocessing and TMS folks who try to lump central sensitization in with mind-body neuroplastic pain, as in it's all in your brain conditions, also fail to state and acknowledge what is being said in this article on central sensitization, which is that you can have central sensitization along with demonstrable peripheral disease that is driven by ongoing nociceptive input, so something external or internal physically painful that's happening, and that when it's removed, as in finding the root cause of your pain, the features of central sensitization, partially or entirely remit. They go away. You get better. In other words, you can have central sensitization as part of having physiological real illness that will go away, not by treating your stress, but when you treat the root cause. Somehow this information is conveniently omitted when people are trying to sell you programs and books where you will deep breathe yourself into a cure. I'm just kind of joking. Obviously you're doing more than deep breathing, but rewiring, unlearning your pain. That may be very helpful for many people, but many other people also have chronic illness and chronic pain from physiological nociceptive input, and it will not get better until you remove it. And then your central sensitization will partially or entirely remit. So this is in direct contradiction. Here's a doctor's webpage about central sensitization, just completely ignoring everything that medical journal article said and telling us in bold letters, chronic pain is caused and perpetuated by the brain, not the body. The article I just quoted from and showed you clearly states that that is not true, that there are many chronic illnesses, chronic pain causing diseases that perpetuate chronic pain in the body. And I just wanted to take a second and look at this central sensitization inventory test questionnaire that is given to people to decide if they have this. And I read through all of these things, and I'm basically kind of horrified. Because while this might indicate that someone has central sensitization, when I looked at the majority of these points, these are things that could occur secondary to almost any chronic pain condition or any chronic illness, even ones that have physiological proven causes. Chronic pain in general, even from a physical cause, is going to make someone not sleep well and could make them anxious and could make their body feel tight and achy from the tension of the ongoing constant pain. You could need help performing tasks due to a legitimate disability. The tension of weird postures trying to avoid physical pain could easily cause headaches, as could increased heart rate from constant pain. It's hard to concentrate when you're in constant pain. You feel sad and low energy when you have ongoing pain with no relief. The worrying about this ongoing untreated pain causes tension in your jaw. And there's a bunch of questions about pelvic type symptoms. Well, there's a lot of actual physical pelvic diseases. So this question in no way rules those things out. It does seem to be ignoring the fact that there isn't very much research, and we know for a fact that female pelvic diseases are under-researched and understudied. Another amazing thing about this list is that if you study menopause and the symptoms of menopause or hormonal insufficiency, this list is almost entirely symptoms of low hormones. If you look up symptoms of low progesterone, what happens when you live with insufficient testosterone, insufficient estrogen, it's like this is the list. So 50% of the population going through a normal event that has a root cause is going to feel these symptoms just as part of that normal process, but also it has a pretty safe and normal treatment of just hormone replacement. I follow a lot of accounts and doctors that talk about the benefits of progesterone, testosterone, estrogen, what happens when you take medications that throttle or limit, suppress these hormones, and what happens when you age to both males and females. And it's super interesting, but it is basically like lower energy, getting depressed, muscle tension, not being able to sleep, which causes all the things. Just not sleeping alone from any reason can cause almost all these things. But especially like needing to urinate frequently and having pelvic pain, having dry skin, testosterone increases sebum production. That's something that you can just look up easily. I've also personally experienced doing testosterone replacement and having just suddenly very oily hair and oily skin, which was nice because I've lived my life with insufficient testosterone and had very dryness. Same thing with estrogen replacement, which I've done systemically and vaginally. I mean, you get moisture immediately. It's amazing. I also have had dry eyes, symptoms of Sjogren's, and those were really related to my living with insufficient hormones. I just recently learned in a newsletter from Parlor Games, who make hormone replacement over-the-counter creams. They make DHEA cream, progesterone, and estriol cream, about how like progesterone works on GABA receptors. GABA is the primary inhibitory neurotransmitter, how that affects muscle tension and sleep. I just read an article about DHEA improving sleep. Anyhow, I just think it's a lot more complex than this list is making it out to be. And while I accept and believe that central sensitization is probably involved in a lot of chronic pain states, as well as peripheral sensitization, we cannot ignore the fact that there are many chronic pain conditions and physical things that can go wrong in people's bodies that we don't currently have good diagnostic protocols to detect. What we do have is an epidemic of underfunded, under-researched conditions that primarily affect female people, and a history of telling everyone with those diagnoses, male and female, that their conditions, in the absence of the research that should be there, that it's caused by their emotions and their brain, which is where you get into trouble with labeling it central sensitization without doing due diligence.